For more than 40 years, Morehouse School of Medicine has stood as a pillar in the community, providing critical care and service to underserved and vulnerable populations, addressing health disparities, and educated and training physicians and healthcare professionals dedicated to culturally competent and compassionate care. We have worked within the community and alongside community leaders to advance access to populations who sometimes fall through the gaps within our healthcare system. Recognized for our social mission, Morehouse School of Medicine remains committed to advancing primary care, recognizing that it is a critical element in the continuum of prevention to wellness. We continue this legacy, though, through our new vision, leading the creation and advancement of health equity. Throughout the year, we have moved closer to achieving this vision through the implementation of our strategic plan, Excellence Through Health Equity. This plan serves as the pillar to our work as a leading academic medical institution, research enterprise, and community partner. As we work towards our vision, we do so through four lenses: who we educate and train, who we partner with, what discoveries we pursue, and how we deliver care. This is our sea change. In 2011, we made a decision to increase our class size. Why? While we were founded to address the physician shortage in Georgia, to diversify that physician and scientific workforce, we understood that we needed to expand our impact. The solution was more primary care providers and other healthcare professionals committed to equity, health equity. Approximately 140 of the 159 counties in Georgia are designated as a medically underserved area, meaning that there are not enough physicians or healthcare professionals in that area to care for the population. So in order to improve access to quality care and ultimately to improve health outcomes, we knew that there needed to be more practicing physicians in those areas. And by increasing our class size, enhancing and bolstering our pipeline efforts, and creating new programs, Morehouse School of Medicine could make a difference to impact those medically underserved areas. Partnerships are critical to the success of Morehouse School of Medicine and our ability to advance health equity. Support of our programs is dependent on who we partner with. Partnerships and collaboration allow us at Morehouse School of Medicine to extend our reach and to grow our impact. For example, when we consider our pipeline programs, we know it's important for us to begin touching the lives of young people as early as K through 5. A student who can't read on grade level by 3rd grade is 4 times less likely to graduate by age 19 than a child who reads proficiently by that time. Throughout our more than 40-year history, we have to and must continue to partner with amazing organizations and community leaders. 3 partnerships we're extremely proud of and truly reflects our mission and vision is our partnership with the Atlanta Public School System through the Tuskegee Airmen Global Academy, our partnership with the state of Georgia, and lastly, we would not be here if it were not for Grady. The discoveries we pursue matter. As we consider the innovations underway at Morehouse School of Medicine, we ask these questions. Whose life will be changed? What communities will be served? What population will be impacted? We have focused our research efforts in disease and care delivery areas that disproportionately impact underserved and vulnerable communities. Diseases like cancer, cardiovascular disease, neurological disease, and infectious diseases. How we connect basic science research, clinical research, community-engaged research, combined with health science and health policy research, how we connect those to discoveries that originate in our labs ensures the TX of our research. TX is defined as both an approach and philosophy, rather than a translational research phase. It represents this opportunity to achieve synergy between evidence-based discoveries and partnerships that will advance the science and practice of improving health outcomes. Many of these communities or populations carry the burden of a given health disparity. Our goal at Morehouse School of Medicine is to move from a catalog of health disparities to interventions leading to health equity. At Morehouse School of Medicine, delivery of care is a continuum. It begins with creating an environment of success for both our current and our future patients. We recognize that there is a direct relationship between education, socioeconomic status, and health outcomes. We believe optimal health care delivery begins with prevention, wellness, and care coordination. So our partnership with United Health Foundation and Optum through a patient-centered care model expands not only access to quality coordinated care, but it allows primary care physicians and community partners to improve patient outcomes, such that once a person is a patient of Morehouse School of Medicine, it is compassion and evidence-based medicine that drives how we will care for that individual. However, our engagement does not end there, but we know that in order to build bridges between healthcare and health, our role must also center around addressing the social determinants which can serve as barriers to success for our patients. The elimination of those barriers allows for a great individual and subsequently a great community outcome. With our strategic plan as our blueprint, Morehouse School of Medicine is well positioned to lead the creation and advancement of health equity. We have a lot of work to do, but we are confident that our educational programs are creating the workforce needed to advance a healthier and more equitable future for all, that our discoveries and innovations in research will ensure that we are meeting the needs of the people we serve. And lastly, as we deliver care, we are building that bridge between healthcare and health. We thank our board, our faculty, our students, our staff, and our alumni for their unwavering dedication to our mission and for upholding our core values of excellence, wisdom, knowledge, service, innovation, and integrity. We also thank our legislators, our philanthropic community, and partners for their continued support of our programs and efforts to create a more equitable future. Together, we are on a mission. Thank you for listening to the Morehouse School of Medicine State of the School Address.